Hello, it's Dr. Rhonda Johnson. Today is Monday, April 5th, 2021, and today I'm going to be discussing a troubling article which was published in the Journal of the American Medical Association online, the Pediatric Journal. Now, the authors in this journal article tracked the number of kids who lost a single parent or who lost both parents due to COVID in the United States, and the results were absolutely troubling. According to the authors, as of February 2021, between 37,000 to 43,000 children between the ages of 0 and 17 years of life have lost at least one parent due to COVID-19, and 3/4 of these children were adolescents. Now, I wish to note that this paper uses data modeling. It is not really possible to count deaths directly because death certificates do not contain information on the number of dependents of the deceased. So in this article, it states that Black children are disproportionately affected. Black children comprise only 14% of children in the United States, but 20% of those who lost a parent to COVID-19. So the article also discusses the impact of parental death on children. Now, we know that children who lose a parent are at elevated risk of mental health issues, and that can include traumatic grief disorder, depression, poor educational outcomes, meaning high school dropouts and poor performance in school, also unintentional death and accidents, or suicide. So the pandemic has been hard on families economically and socially, and these effects can persist into adulthood. Sudden loss of a parent can cause immediate economic hardship to a family. And this is occurring at a time when many children and teens are already suffering through school disruption, loss of after-school activities, loss of recreational sports leagues, and profound social isolation. Now, when children lose both parents and due to COVID, someone else has to step in and care for them. So not only do you have grief and adjustment for the children, but you also have emotional adjustment for the family that steps in to take care of the children. And sometimes children have to be separated. And because of COVID, many traditional grieving rituals such as funeral rites and saying goodbye have been disrupted. So the authors of this study compare the losses of COVID to the attacks on September 11th here in the United States. Did you know that the September 11th incident left 3,000 children without a parent? Now, as bad as that was, you compare that to 37 to 43,000 children who have lost parents due to this pandemic. Folks, the toll of this pandemic on our nation, and in particular our nation's children, is enormous. There are so many children who are behind in their immunizations, their well child and health supervision visits. They're behind in their learning. They haven't done well with virtual classrooms. Many children have faced hunger. They may have seen more intimate partner violence and experienced child abuse and neglect. And children who have lost the protection of their biological parent may be at more risk for maltreatment by a caregiver. So we've got to watch this situation carefully. And the other challenge may be when one family member in the household gets COVID, others are usually infected. And the remaining parent may suffer physical and mental health impairments as part of the long haul long COVID syndrome. So that is one more reason I'm going to bring up the COVID vaccine. Parents who are still on the fence, think about the impact that should you get COVID, it could have on your family if you don't survive. We still don't know how to predict who's going to get mild illness and who's going to get severe illness and or die. But we know one thing, that the COVID-19 vaccines, all of them, are 100% effective at keeping you out of the hospital, keeping you out of the ventilator, and keeping you out of the morgue. So parents, please, don't leave your children at risk. We have a new wave of disease. Expected cases are on the rise. Young people are the ones who are getting ill and in the hospital. We don't need to lose 10 more thousands of parents, leaving children who have lost a parent to COVID. Who's going to absorb all of the mental health challenges for these children? Who's going to manage their lives? Many African American children are already growing up in single parent households. To lose their only parent will be quite devastating. Obviously, you can see that this study troubled me. It troubled me last year, and I did a video in year one of the pandemic about the risk of all these orphan children. We got to remember that the effects of COVID-19 extend beyond healthcare. So parents, please add this consideration to your decision making. Fear the virus, not the vaccine. And of course, please keep up all the other prevention tools such as mask use and socially distancing. Stay safe, folks. My views are my own. And as always, have a blessed day.